Hello, I am Dr. Prativa Mishra, Senior Consultant Ophthalmologist, Utkal Hospital, Bhubaneswar. Today, I am going to talk about very emerging topic, diabetic retinopathy, which people are not aware of it much. But let me tell you, diabetic retinopathy is one of the leading cause of blindness in world now. Do you know, in 2017, around 425 million people were diabetic. But now it is seen that in 2045, around 629 people will be diabetic. See how rapidly it is increasing diabetes. So as diabetic retinopathy. It is increasing very rapidly. Now every 1 in 5 people are diabetic. And regarding prevalence, let me tell you, you will be very surprised to know that after 20 years of diabetes, in type 1 diabetes, 99% they develop diabetic retinopathy, means leading to blindness. And while in type 2, around 60% of type 2, they develop diabetic retinopathy. And risk factor, let me tell you, there are several risk factors of diabetic retinopathy. Most important is uncontrolled blood sugar. Second is duration of diabetes, that means prolonged duration associated with uncontrolled BP, increased cholesterol level, pregnancy and smoking. Uncontrolled blood sugar level, definitely in our hand, it should be at least glycosylated hemoglobin should be at the level of 7. Regarding prolonged duration, definitely we can't do anything about it. Uncontrolled BP, it rapidly increases from non-proliferative retinopathy to advanced retinopathy. So control of BP is absolutely necessary. Control of cholesterol level by medication, and pregnancy as well as smoking has to be taken care of to reduce the incidence of retinopathy. So regarding screening, annual screening is a must for all diabetic. In type 1, that means juvenile diabetics, young age people, after the diagnosis of diabetes, you should do the eye checkup within 3 to 5 years of diagnosis of diabetes. While in adult, it should be done as soon as diabetes is diagnosed. While in type 2 diabetes, shortly after diagnosis, screening should done. Screening means what? Eye examination. Eye examination include your detailed vision checkup, refraction, intraocular pressure measurement, fundus examination, and if necessary, fundus photograph, OCT retina, that is scan of retina, and fundus fluorescent angiogram. Whatever advised by your ophthalmologist, please do it. And regarding after screening, all diabetic should be referred to the physician, endocrinologist if possible, and cardiologist as well as nephrologist to rule out any other organ involvement. Do you know early case of diabetic retinopathy? Like in early non-proliferative stage, unless otherwise associated with macular edema, they don't complain anything. They don't have any problem. So they don't go for eye checkup. They feel our eyes are fine, why should we go for eye checkup? But when they go to the advanced stage of retinopathy, that time they complain of blurring of vision, some floaters in the field of vision, then diminution or sudden loss of vision. That time they go to the eye doctor. That time you can treat it, but they will not never get back their normal vision. So absolutely it is necessary. Early diagnosis and early treatment is absolutely necessary for prevention of blindness. So my take home message for all diabetic, please check your eyes in proper time at least once in a year, which is absolutely important. Do you know only 60% of diabetic they go for eye checkup, 40% they don't go. And in our OPD, when patient comes, usually 70% of diabetics they present with eye problem. Means they don't go for the eye check, they didn't go for the eye checkup earlier. So early diagnosis and treatment is a must for all diabetic.